Hi, this is Dr. Levin, and this is
Susan McGuire.
Today is the 14th of March. Susie came to see us a few years ago with cervical post-laminectomy syndrome and severe recalcitrant headaches. So tell us about what you had before, Susie.
When I first came in here approximately 2 years ago, the headaches were constant every day.
How long have you had the headaches for at that time? Years, days, months?
Well, they were diagnosed as cluster headaches, where they come out for 3 months and then they may go away for 3 months. But at the time when I came in here, the headaches were out for about 3 months.
And how many years have you had the cluster headaches?
12.
12 years. Mm-hmm. And so you'd been treated by different modalities at that time throughout the 12 years?
Yes.
What have you tried at that time?
Every kind of medication.
IV infusions?
IV infusions, steroids, the 7-day steroid pack, which when I came into here in December, I was doing the steroids, 500 milligrams, 3 times a week, IV, through December, through January.
That was just this year, but let's talk about the last 12 years. You had basically 12 years, and were those therapies particularly effective, or?
No.
Okay, so you went to see me, and this is 2 years ago. We did some facet injections, I think maybe a couple of transfemoral epidurals, so some radicular pain in your arm,
yes,
and some weakness and numbness.
The pain in the arm immediately went away after the injections.
And the headaches?
The headaches, yes, they did go away, but then they did come back maybe a month or so, and then we did the injections again, and they did go away for months.
How many months were they away after the 2 years?
18 months. 18 months I was headache-free.
Great. And then recently you had headaches starting when?
December.
December. And these were the same typical type of headaches?
Yes.
Oh, can you describe them?
Over top of the left eye, right in the corner of the eye. Stabbing, pulsating, feels like a knife's going in it and twisting around. Wake me up in the middle of the night and would last sometimes up to 2-3 hours. The next day would be like I would call it like a lingering headache, where the headache would still be there, bearable, but still there.
And you had, in December, started treating with a neurologist, where you had been given IV infusions of steroids,
yes,
and other medications, and
yes,
verapamil.
Yes.
And did you try Imitrex or
yes,
triptans? Were they helpful a little bit?
No.
Okay. And so then, I think you had this for a month and a half, 3 times a week.
Yes.
Steroid infusions.
Yes.
And then a dose pack.
And then the dose pack.
And did that help you at all?
Maybe the night that I got the infusion, I might have been headache-free. But then it came right back.
The next day?
Yes.
And so then I think you saw me, the headaches were happening.
And then
how
I
often?
told you, I believe it was the end of January.
And I wanted to...
We couldn't do anything because I had all the steroid in my system.
I think I'd wanted you to take a steroid vacation.
Yes. And then it was around mid-February we did the injections.
And we did facet injections.
Yes.
And what happened after that?
And I was headache-free for about 2 weeks. And then in the past month, I may have had maybe 3 headaches.
Were they as severe as they normally would be?
Yes.
How frequently would you normally be getting these headaches?
I was getting them daily.
So you were getting them 30 out of 30 days or 31 out of 30 days in a month, and
yes,
now you had 2 or 3 in the last month.
Yes.
Great. Okay, so I think we're doing well. So did you notice a difference with the injections, obviously, versus
yes,
the other therapies?
Yes.
Great. Thank you so much.
You're welcome.